Hey guys, I'm back. More talk about the thyroid situation. As you can tell, I still don't have my voice back fully. I actually went to speech therapy today. I'm going to be starting that. I have my evaluation, but we're not starting that until after I have the radioactive iodine. Everything's getting really real. I'm getting booked with so many appointments. I just had blood work done today. My TSH is still high, which means that my dose for my Unithroid, which is what they have me on, my dose is still low. So I'm going to need to go up on that dose. But first, of course, I'm going to need to do this radioactive iodine before we worry about that. Hang on, bear with me. I'm just trying to pull up my labs because I think I got some more results at work that came through. But yeah, so my scar is this. I have this dent here now. I guess that where my thyroid was bulging out a little bit, now it's gone. So I have like that trachea dent like thing right there. It's kind of weird. And of course my voice. But so on the 6th of February, that will be 3 months out of surgery from the total thyroidectomy that I had for follicular variant papillary thyroid cancer. So this is how it goes. So on the 29th, I have an appointment for a injection of the Thyrogen. So the Thyrogen is going to reverse my thyroid medication. Instead of me having to go off of it and withdraw for like 3 weeks slowly, this is going to rapidly pull my thyroid replacement down to nothing. I have been on a low iodine diet since last Monday. So today it was a week yesterday. So do the math on that. So today is oh my God, I don't even know what today is. Today is January 23rd, 2023. Okay. So, yeah, so I have the first injection at 10:30 on the 29th. Then I have another injection at 10:30 on the 30th. And then, oh my God. And then on the 31st, I have the NukeMed thyroid. It's called Thyroid Therapy Tumor Ablation. So that's where I'm going to get the radioactive iodine pill, and then I will have to be isolated. However, they are going to do a pre-body scan on that day also before I get my radioactive iodine pill. So they're going to do a body scan to look and see what it shows. That way they can compare it to the one that they're going to do after the radioactive thyroid, radioactive iodine. Sorry guys, brain fog is real when you don't have a thyroid. So they're going to do another scan on the 8th, February 8th. And I'm going to have to stay on this low iodine diet until then. It's not fun. However, I know it's very necessary for my treatment and to get the best outcome, because what happens is you go on this low iodine diet and your body, when you take the radioactive iodine, any thyroid tissue that is anywhere in your body is going to suck that iodine up and hold on to it for dear life because you're starving your body of it. And that's what feeds thyroid tissue, is iodine. So as much of a pain in the butt it is, and not tasty, not fun, I'm doing it, and I'm going to get through it. So I have come up with some good recipes. As a matter of fact, I made myself chocolate chip cookies last night You just have to use egg whites, and they sell egg whites in a carton at Target, and it's so convenient because so many things that you have to make, like I made homemade soft pretzels. I think I kneaded them a little too much, so they came out really tough. Not much of a bread maker, so anyway, but I did make homemade cookies, and they have non-iodized salt at the store. So instead of using buying stuff, you have to make everything homemade and add your own non-iodized salt to it. You can't get any fast food, you can't get any restaurant food, you can't get any prepackaged meals. It's a lot of work, but I think I've got it down to a system. And I found a couple coconut milks that don't have any sea salt in them. That's a huge thing. Coffee creamer. I found a couple coffee creamers that have no sea salt, no carrageenan, non-dairy. It's really meticulous, the things you have to look for. But you know, again, it's a lot of work. It takes dedication and a lot of prepping and time. But again, it's for a good reason. So that's why we do it. So recapping, the 29th and the 30th, I'm going to get Thyrogen injections, which is going to bring down the thyroid medication that I'm on. I will stay on my medication until those days. And then the 31st, I get a pre-iodine body scan. And then that same day, right after the scan, I will take the radioactive iodine. Then I will have to go immediately into isolation. I'm doing that here at my house. Luckily, we have a split floor plan where I have bedrooms on the other side of the house and a bathroom all to myself. This is my bedroom here, my usual bedroom, and it has a bathroom attached to it. So I'm just going to probably let my husband have this, and I'll stay over there. It'll just be easier. And then get that body scan on the 8th, February 8th, to see what the results of all this are, and hoping that I don't have any metastasized tissue anywhere. And then on the, I think it was the 12th, no, the 14th, I think, is when I go back to speech therapy again. So, excuse me. But, you know, it's a process, and I can't project my voice. I can't scream if I needed help. I can't sing, and I really like to sing. I think I told you guys that before. I'm also starting mental health therapy tomorrow, which is really good because it's been trying. I think, you know, you guys, if you've watched my other videos, you know I waited for over a month for my results, and that really messed with my head really bad. Oh, another thing, I don't know if you guys can notice, I'm getting a lot of acne. I've always had red cheeks because of the lupus, but I've got a lot of breakouts, and that's new since the thyroid's been out, because I usually don't have any problems with any acne at all. So there's that. But I think, you know, we've got the plan going now, and I'm probably going to, you know, be updating you a lot more now. Sorry for the pause, but I think I told you guys that I was going to just, you know, go. I went to Wisconsin and visited my grandbabies and had my new grandson. He was born, and spent Christmas over there with them, and just kind of took my mind off of everything, and then came back and got back in the swing of things. So I think I told you guys I probably wasn't going to make any videos until we were about ready to do this anyway. So, but we're back on track, and you should be expecting videos from me sporadically, you know, throughout this process that we're going through. All right. Thanks for hanging in there with me, guys. See ya.